you could allow me now to change hats and have the honor to present to you our keynote speaker for the day. Dr. Mickey Moorman is not only a speech therapist, but also an ENT, a phoniatrician, and head and neck surgeon with more than 30 years of experience and with many publications signed by her name. She is she's having a lot of honorary positions. She's currently the president of the Belgian Society of Laryngologists and Phoniatricians. She is the vice president of Union of European Phoniatricians and the chair of the Dysphagia Committee of IALP, International Association of Communication Sciences and Disorders. Across her year of experience, the consciousness grew that people suffering from communication and swallowing problems are socially invalid and that these people deserve more attention and care. And therefore, since September of 2019, she developed telephone.digital as a software as a service to provide therapy support to a multidisciplinary setting. Let me encourage people to use chat during the presentation for comments and questions. And for those on Facebook, please use the comment section to communicate and ask your questions. As mentioned before, we are monitoring both. It is my honor to give the floor to Dr. Moerman. Thank you for accepting our invitation. The floor is yours.
Thank you very much, Maria. Thank you also, Norma, Fofi, for having me here on this wonderful day, this celebration day for ASLA. I am going to turn my video on. One moment. Can anyone else perhaps turn my video on? Or perhaps it's not necessary. Just a question. Before we start off, I would like you to fill out a poll. And I don't know, Fofi or Maria, you told me that there was not a possibility to tick a box, but that you would work with raised hands. So is anyone going to monitor the hands raised?
I can monitor your, yes, I will monitor the hand raises.
Wonderful. Thank you very much. So my question to the audience is, who amongst you already uses any kind of e-health? Whether this is merely an administrative file or video consultation or whatever. So who is using a digital administrative file right now as an e-health tool? That is the first question.
Obviously, a lot of people.
I see 15 participants raise their hands.
Yes.
Okay, then the next one. Who is using e-health nowadays as a digital therapy support? So this means who is using the tool as a therapy guidance? Do you deliver therapy from remote, from a distance?
Here it says 22 participants raised hands, or even more, 24.
Who is using teleconsultations by video?
Also 22, about, yeah.
And who is measuring outcomes with an e-health tool? Around 12.
Yeah, 12. Yeah.
Any other means you use eHealth for? About 10.
Mm-hmm. Yeah.
Okay, thank you for answering. We will come back to that later. But first, I wanted to introduce myself a little bit more. One moment, I'm going to put this on. Yeah, here we are. So I am, as Maria introduced myself already, I am Mieke Moorman. I am an ENT and head and neck surgeon, a phoniatrician and a speech therapist. And indeed, during 30 years, I have been confronted daily with people with communication and swallowing disorders, whatever origin, neurological, oncological. This picture speaks for itself. All laryngectomy patients experience communication and swallowing problems to some extent. And next to that, we can think of Parkinson's disease, stroke, and so on. Their social inability strikes me a lot, and I wanted to do something meaningful for them to help them fully participate in our society again on a larger scale than just a private practice. Hence, a year and a half ago, I exchanged my clinical practice to start up Telephone.Digital, which is a certified web-based tool offering personalized guidance to people with communication and swallowing problems, with the help of speech-language therapists. Do I have anything to disclose? In a way, yes, because of this social enterprise Telephone.Digital. But then the startup gave me the opportunity to study the regulations in depth. And this talk mainly wants to give an objective overview of the current European philosophy and prerequisites for tele-tools and how we as speech therapists can comply. After a short intro that highlights where we come from and where we are going to, we will cover 3 actual spearheads characterizing digital transformation in Europe. After some closing remarks, there will be ample opportunity for questions and answers. Now, where do we actually come from? Healthcare has been gradually evolving from evidence-based practice over value-based healthcare towards, nowadays, smart healthcare. Evidence-based strategy has been the first and necessary step in the good direction and is still continuing. However, the focus in evidence-based healthcare remains on the healthcare provider. How well do I, the surgeon, operate? How well do I, the speech therapist, manage my patients? Evidence-based practice measures therapy performance, a therapy which has been decided upon by the caregiver. There is no doubt that evidence-based healthcare has led to accurate guidelines worthwhile following and educating, sure. But the focus in healthcare starts shifting from therapy strategy towards how is therapy perceived? Patient's perception, patient's value. In value-based healthcare or value-driven healthcare, the focus shifts towards the patient's experience and perception. Michael Porter defines patient's value as patient-relevant medical outcome divided by the cost it takes to achieve these goals. So the patient is getting a more centered position. Patients are seen as partners of their healthcare providers. And providers look at their patients not only from a clinical perspective anymore, but also from an emotional, mental, spiritual, social, and even financial perspective. And this actually complies with the ICF philosophy, the International Classification of Functioning. Now, can we conclude that the type of therapy does not matter anymore as long as the patient experiences value? This is perhaps too simplistic. Of course, we must apply what we have learned from the previous stages in our healthcare evolution, more specifically from the evidence-based practice guidelines. Good practice leads to added value. But time does not stand still, and neither does the evolution in healthcare management. Now we are entering the era of smart healthcare. Smart healthcare refers to smart technology, information and communication technology, ICT. That leads to better diagnostic tools, better treatment for the patients, and improvement of the quality of life. The key concept of smart health includes e-health and mobile health services, electronic record management, smart home services, and intelligent and connected medical devices. Terminology is abundant. The term e-health, telehealth, or telemedicine comprises applying information and communication technologies at the service of healthcare. At the service of healthcare means to improve prevention, diagnosis, treatment, monitoring, and management of health-related issues, and to monitor and manage lifestyle habits that impact health. Digital health and care refers to the tools and services that use ICT. The term products covers all information and communication technology devices, such as software as a service, medical devices, mobile health devices, such as wearables, and so on. This subdivision is somewhat arbitrary, of course. In practice, this means that e-health in speech-language pathology will use information and communication tools and services provided by a technology product. What are the aspirations of Europe concerning e-health? What does Europe aim for? First, Europe wants people to manage their own health. Europe advocates patient empowerment. Second, Europe wants to ensure personalized and adaptive care paths. In other words, personalized care. Europe wants also to enable more efficient and effective therapy in casu, and this is very important, through outcome measures. And Europe wants patients and care at home. This concurs with the ICF philosophy of the WHO, which states that patients, eventually with a residual disability, must be reintegrated in society. In short, Europe loves optimizing health through a value-based and patient-centered designed care flow. Remember, value-based is not only patients' perception, but also the costs related to healthcare. A patient-centered design includes the patient's right to comment, ask questions, and make complaints. In the current smart health era, where data from sensors or genetic fingerprint and so on are sent to computers, it means that the patient is in control, that she or he remains the owner of her data. And caregivers evolve actually more and more towards data specialists and coaches. They merely guide patients, in casu from a distance, by means of teleconsulting or triggering actuators in clothing. Clinical observation tends to evolve towards a validation tool of the data-driven decisions. Again, and I think this will launch some doubts and trigger some questions afterwards. Clinical observation tends to evolve towards a validation tool of the data-driven decisions. Europe wants to monitor the process towards smart health based on 3 pillars. Pillar 1, deals with secure data access and sharing. To facilitate greater access to cross-border healthcare, the Commission is building the e-health digital service infrastructure. This allows e-prescriptions and patient summaries to be exchanged between healthcare providers. The first cross-border exchanges started in 2019 with the goal of having all the other EU countries on board by 2025 in a European electronic health record exchange format that is accessible to all EU citizens. The following issues have to be taken into account in the premise of safe and secure data processing. First, informed consent. The patient or client must undertake an action to agree with the use of the tool. For instance, ticking a box, I concur with the terms and conditions, during the registration process. Very important, this agreement may not be filled out by default. Second, privacy. Similar to the informed consent policy, the privacy statement must be clearly indicated by preference on the app's homepage. The acceptance must be actively conducted by the patient client. It may not be filled out by default. In addition to that, in case of any exchange or transfer of personalized data, a supplementary consent is advisable. The fundamental user rights contained in the GDPR are seen as best practice. Safety. During the communication over the internet, the safety and the security must be guaranteed as much as possible. The following suggestions have been formulated. A registration or a login with a two-factor authentication, or at least with a sound password protocol. Video communication tools inherently represent personal features by moving images and hence concur with that two-factor authentication. It is advisable, however, that both users really identify each other. In other words, do not perform a video communication sitting in front of a black screen under the pretext of failure of a webcam on the other side. Next, use an end-to-end encryption, a system of communication where only the communicating users can read the messages. Data is encrypted on the one end and decrypted on the other end, so only sender and receiver can read it. Avoid links in any communication. Integrating links into a written communication bears the risk of interception and hosting an unknown party, an unknown third party into the conversation. Use up-to-date web browsers, such as nowadays Google Chrome and/or Mozilla Firefox. And last but not least, separate data storage from tools foreseeing in other functionalities. For instance, separate the financial data from results logging and so on. And the tool must not be connected with social media at all times. The second pillar intends to tap into the huge potential of health data to support medical research with the aim of improving, optimizing prevention, diagnosis, treatments, drugs, and medical devices. This implies specific technological requirements such as the interoperability. The Health Level 7 International HL7, and the Fast Healthcare Interoperability Resources, FHIR, are the current technological standards and are highly recommended by the Commission. Did you know that 700 billion is the estimated wasted spending per year due to lack of interoperability in health systems? That 18% of medical errors leading to adverse drug events could be tracked back to missing data in the patient's medical record? Other technological requirements linked to the societal goals are availability. Ideally, the tool should be readily available at any moment in time and at any location or place around the globe. Ideally. Availability also concurs with user-friendliness, providing access by means of multiple devices, tablets, PC, smartphone, mobile responsiveness, providing access in various languages, and so on. Sustainability can be interpreted as the viability of the tool on long term. In other words, can the tool endure, respond, adapt to environmental policies and changing demands? In general, a web-based tool can be regarded as more adaptive and flexible and hence sustainable compared to locally installed apps. Scalability. This means that the system can cope with a growing amount of workload, a huge amount of users. Does the tool fancy upscaling? And is it technically able to? Is the tool stable and competitive and ready for more resources? The third pillar deals with strengthening citizens' empowerment and individual care through digital services. Digital services can empower citizens, making it easier for them to take a greater role in the management of their own health, from following prevention guidelines and being motivated to lead healthier lifestyles, to managing chronic conditions and providing feedback to healthcare providers. Essential is increasing patients' adherence and motivation. Only then they will engage, act, and respond. Often, and certainly applicable in speech-language pathology, the way to go is through translating outcome measures into interactive plays and games. Applying all this to speech-language pathology, immediately various challenges and difficulties rise. What outcome measures are robust? How can we accurately and objectively measure them, except from interviewing and questioning? How to guarantee GDPR compliance whilst we are using fingerprint parameters such as voice or visuals? How and when do we need to anonymize personal data without losing information? How to deal with the large intra and inter-individual variability? What is the ideal design for a valid and robust framework in view of data processing and analysis? And this one, how to avoid the sense of disruption. And I mean the sense in you, speech-language therapist. Do you feel threatened or enriched by smart health? Remember what Norma told. People fear changes. And this then leads to our second poll. How do you feel about applying digital health in your practice? Who is using digital health right now 100%, always? Just raise your hands. About 7 participants use, 10 participants always use digital health. Okay, 11. Who is using digital health partially combined with physical therapy? (26) 27 participants used a combination of physical and remote guidance. Who does not use it yet, but is eager to start it? Who wants to start it right away? And who did not yet use it before? Who is feeling triggered? About 14 participants. And then who is frightened? Who is resisting unless forced into it? You only will apply e-health when someone in a higher rank tells you you have to do it. 10. And who is a non-believer and will always resist? Who is believing in physical therapy only? 8 participants. Thanks again for answering these questions. Before we go to the question and answers, I would like you to take some minutes to study this overview. Just read it through, a couple of minutes. This actually is a very good summary of the things I wanted to say in the view of Europe and the European Commission and the European market. Look at the left bottom corner, what EU citizens expect. So this is actually results of a questionnaire. So this is quite striking. And then we have again 1, 2, 3, the 3 pillars of which I was speaking about. Are there any questions, concerns? You can raise them now, or you can contact me privately on one of both email addresses. I hope you enjoyed that you enjoyed this morning. I am very grateful, and I want to thank the organization for having me here. And I wish you good luck with this new association, ASLA. So yeah, thank you very much for your attention, and shoot.